Hi, I'm Graeme, Chief Exec of SCMA. The childminding guidance has been updated again to support the wider reopening of nurseries and schools from Monday of next week. So I thought I'd record a video pulling out the key points you need to be aware of. To be clear, there aren't too many changes in our guidance, but there are some important changes that you need to be aware of. So within this update, I'll provide information about the families that you support, an update on blended placements. There's some particular compliance areas to be aware of. There's more information for those of you who may be pregnant, and also an update on testing for childminders. So I'll try to cover this in about 10 minutes or so, but you might want to grab a tea or coffee while watching this. I think the first thing to stress is that the nature of the guidance and what's behind it. This doesn't represent a sudden reopening or return to normality. The wider reopening of childcare and schools has been prioritised ahead of other areas of life for the sake of children's well-being. We've been fortunate that childminding has largely been able to remain open over the last couple of months due to our smaller setting size. What we'll see next week is what I would describe as continued minimisation of movement with a very cautious and gradual relaxation. So nurseries, which have had to restrict their service to key workers and vulnerable children since Boxing Day, will be able to reopen fully. For schools, primary 1 to 3 children will be allowed to return, and also some senior pupils in high schools, but even then on a very, very restricted basis. No more than about 8% of children in high school at any one time initially to support those needing to do practical work. So looking at the families that you're allowed to support, for the vast majority of you, you can still continue to provide childcare for all families, and that includes both preschool and school-aged children. For larger settings, who've only been able to support key workers and vulnerable children since Boxing Day, there's been a partial relaxation. Settings currently caring for 12 or more children can now, from Monday the 22nd, care for any families where the children are of preschool age. So to be clear, that's from birth up to 4 or 5 and not yet attending school due to their age. Unfortunately, larger settings currently caring for 12 or more children will still not be able to care for school-aged children unless they're from key workers' families or are vulnerable children. Now we know this appears inconsistent when school-aged children are allowed to be cared for in the majority of our settings, but this is still down to numbers and a desire to minimise the number of contacts and amount of movement in community at this time. I'm very pleased to confirm that blended placements are still allowed. As before, single placements are preferred to minimise the risk of the number of contacts, but blended placements are clearly allowed and supported by the new guidance issued today, which states that blended care is permitted to support high-quality childcare and to meet childcare needs, and keeping the settings involved as consistent as possible. We know this is really important to many of you. Now, while it did look recently as though there might be some restrictions on blended care, SCMA has worked hard to inform this area so as to ensure that the Scottish Government's public health advisors understand childminding and the nature of blended placements involving childminding settings. This is important as there is no evidence over the last 11 months that there has been any increase in transmission or cases of the virus arising from blended placements involving childminding settings. Blended placements have also been allowed over the last 7 weeks, while the latest wave was at its peak. So it was really welcome during a national recovery meeting last week that I attended that senior Scottish Government medical advisors confirmed to SCMA that it's not the intention to stop anything which might already be happening. This is an important point for everyone to be aware of. However, it is recognised that childcare has been quite dislocated since Boxing Day. Some of you may have had children in your settings on a temporary basis as a result of other providers being closed. And now that other providers can reopen, we may see some movement in children between settings. Nurseries and other larger settings, which are reopening next week, will be required to undertake risk assessments for all children. So similarly, this also applies to childminding. So what this means is that for blended placements, which you may already have, and parents and you wish these to continue, you will need to refresh your risk assessments in conjunction with parents and any other provider involved. And if you wish to take on any further blended placements from next week, as a result of nurseries and schools reopening more widely, you'll also need to undertake individual risk assessments in conjunction with parents and other providers. When undertaking these risk assessments, parents and providers should give consideration to measures within the guidance around risk assessment, hygiene and physical distancing. SCMA has previously produced a template for members to support them in undertaking risk assessments. We're currently reviewing that to reflect the new guidance, and we'll share this with members shortly to support you. Now, the guidance also makes clear that this should be done on a case-by-case basis. This is also a really important point, as what this means is it would not be appropriate for a local authority or another provider to decide not to support blended placements at a policy level. Each case must be considered individually and risk assessed on an individual basis with parents and all other providers involved. And for absolute clarity, childminders are allowed to undertake drop-off and pick-up to support blended placements. Moving on, it's clear that to support the reopening of nurseries and schools, compliance with operating guidance is becoming ever more important. And learning from COVID-19 and where transmission has occurred in larger settings such as schools and nurseries has found that lapses in adherence to the operating guidance can occur when staff may have let their guard down, such as during breaks, and they didn't observe physical distancing and mask wearing as much. So as such, the latest operating guidance for all providers has a much stronger emphasis on compliance with the guidance. Now, while a majority of you are sole workers, some of you will have assistants working with you. Where they are not members of your own family or your household, particular attention should therefore be given to complying with social distancing and mask wearing requirements when in close proximity to other adults in your setting, and this includes during breaks. Similarly, the guidance for all providers makes it very clear that parents should be advised not to congregate outside of settings. They should just be dropping off and picking up children and observing social distancing and wearing masks at these times. Beyond parents or carers dropping off and picking up children, the guidance also makes clear for all providers that any other physical visits to settings should be discouraged at this time. Throughout COVID, SCMA has also been asked if it's safe for childminders to continue to work if they're pregnant. The latest guidance has been updated and now states that following the UK Government Coronavirus Advice for Pregnant Employees, which is applicable in Scotland, pregnant women of any gestation should not continue working if it is not supported by a risk assessment. Finally, I also wanted to speak about testing, and I think it appropriate to go into a bit of detail here, as testing is also referred to within our guidance. I'm aware that some of you feel that childminding has often been the last to be included in different areas over the years, and that some of you may be thinking that childminders have been left out once again in relation to testing. The main thing to stress is that we don't believe this to be the case, despite it possibly looking that way. When nurseries and schools are able to reopen from the 22nd, nurseries attached to primary schools will offer their staff twice-weekly COVID tests. This will then be rolled out to other nurseries and private, voluntary and independent settings, and there was no mention of childminding when this was first announced recently. So we raised this with the Scottish Government, and we continue to be in active discussion with them about this. The reason this is being rolled out to nurseries is that the greatest risk with the new variant of COVID, as with existing variants, is adult-to-adult transmission. Nurseries and other larger settings generally have a number of staff working together, and this is why they've been identified as a priority. In contrast, the majority of childminders are sole workers. But there's also another dimension to this and a reason why we're not pushing for this to be rolled out to all childminders at this stage. There are two types of testing for COVID-19, what's known as a PCR test and also a lateral flow test. Both tests involve swabbing inside the nose and mouth, and some of you or your families may already have had the drive-through PCR test if you've experienced potential symptoms. The PCR test is understood to be most reliable and involves being sent away to a laboratory for analysis. In contrast, the lateral flow test is another test which has been designed to get much quicker results and doesn't involve a laboratory. It's a bit more like a pregnancy test in that it gives a result within 30 minutes, and it was developed to support mass rollout of testing in response to community outbreaks. Now, we think it important to be transparent and open with you. Currently, there are mixed reports about the reliability of the lateral flow test, which is the type that will be used in childcare and schools. Some data reports that these tests are as reliable as the PCR tests, but there's also other reports suggesting that they're less so. So what this could mean would be that if you had to do the test twice weekly, you got a positive result from a lateral flow test, you would have to close your setting, self-isolate, and then have a further confirmatory test, this time with a more sensitive PCR test, which would then have to go off and be analysed, and you'd await the return. So if the PCR test turns out to be negative, and the initial lateral flow test had given a false positive result, this could have resulted in an unnecessary interruption to your service. So in our view, if all childminders had to undergo twice weekly testing, and false positive results did turn out to be an issue with lateral flow tests, this could be a double-edged sword for you and quite disruptive to your businesses. As I said, there are mixed reports about this form of testing, and what we need to do is to see more data, more evidence and scientific advice about this. And it'd be wrong for us as an organisation to rush into demanding something on a form of testing for childminding if it actually turned out to have a negative effect on your business. So this is why we need to understand the potential implications first. The Scottish Government is sensitive to the valid concerns of childminders that testing can offer reassurance to you and to the families you care for. So this is why within the latest childminding guidance published today, it states that the Scottish Government is considering what form of testing could be offered to childminders, as it may be that a different kind of on-demand access to asymptomatic testing would be better for childminding. This might be more attuned to the nature of your business as mainly sole workers, instead of twice weekly lateral flow testing, which was based on reducing chains of transmission in workplaces. Again, nurseries are being offered this due to adults working together and the risk of adult-to-adult transmission. Given that childminders are at less risk of adult-to-adult transmission, this is less pressing for us. However, while these discussions continue, what we are doing is continuing to advocate for childminders to be prioritised for receiving the vaccine. Now that's enough from me today. I've gone on for long enough. This update doesn't cover every change to our guidance. Instead, it's aimed to pull out the main points which you should be aware of, and would encourage you to read the full guidance to support your practice. Stay well.